Okay, so what is the difference between like normal therapy and mind-body therapy? It's a question that a lot of people ask me, so let's talk about it. Mind-body therapy has three components, all of which we work with the brain. Pain is generated in the brain, pain comes from the brain, and so when we work with pain cessation, we work with the brain. So the first thing, the psychological work, we're decreasing the sense of danger in the mind-body system. So what we do is we really work with mindset. Pain is a danger signal. So if you have thoughts that are dangerous to the body, like this is gonna hurt, that is gonna hurt, this pain is gonna last forever. Oh, now that it started, it's gonna be here all day. This is gonna be here until I engage in this, and that safety behavior. This is probably here because I did this or that physical thing that didn't truly cause the pain, but the brain thinks that causes the pain and the brain thinks that stuff is dangerous. So any thoughts along the lines of there's something wrong with my body or the expectation of pain, those are the thoughts we're really trying to target and work to modify, because those thoughts cause danger in the brain, which causes pain. And here we also do the work of retraining your body to acknowledge that many of the behaviors that you have stopped doing because you think you can't, the exercises you think you can't do, the movements you think you can't do, the foods you think you can't eat, will retrain the body to learn that those things are actually safe. And what you'll learn through this work, what your brain and nervous system will really absorb, is that you are way, way, way safer than you feel that you are. So that's the first thing, the psychological work. The second part is the emotional work. Chronic pain is telling us that there are emotions or truths that you're holding that you're not really feeling or not really fully acknowledging. The chronic pain is not about the emotions you feel day to day. The chronic pain is about the emotions you don't feel. The chronic pain is not about the difficult truths that you acknowledge day to day. It's about the difficult truths that you don't acknowledge. So in that way, it is different than normal therapy, where typically there's many different kinds of psychotherapy, but in most kinds of psychotherapy, you're working mostly with the conscious brain and conscious thoughts and conscious feelings. We really try to dig underneath that. In mind-body therapy, we're digging deep and we're looking for the stuff that you didn't realize that you were feeling. Coming out of a mind-body therapy experience, clients will often feel surprised, like, I didn't know I was carrying all that. I didn't know that really bothered me that much. I didn't even realize I felt that way, but I do. People really make some pretty profound discoveries doing that emotional work. And it's a very important part of healing chronic pain. Okay, so that's number one, the psychological work. Number two, the emotional work. And then number three is really patiently attuning to yourself and allowing yourself to get to know yourself and really stand in and acknowledge your own sense of power in the world. Number three is definitely the hardest part to explain to people who are new to this work, but as you get into it, you will understand it. It's not confusing once you get it. Most people who suffer from chronic pain have suffered from a lifetime of not fully feeling allowed to be themselves, not allowing themselves to just be. And often it's not, I shouldn't even say often, truly, probably always, it's not their fault. People who struggle with chronic pain are the kind of people who have been asked, or if not forced, to tone their emotions down, tone themselves down, be small, so that they can get along with the people in their world. While that may have helped you get along at certain points in your life, your body doesn't love it. Your body is really trying to express, like, I need to be. My needs need to matter. And so the pain can really be a message from inside of you saying, like, hello, listen to me, take care of me. my needs matter too, and you can't ignore me. So there's the three parts. The psychological work, calming the brain and nervous system, messages of safety, the emotional work, and the work of patiently attuning to yourself and listening to yourself and honoring yourself. And in those ways, it is very different than what one would consider like normal therapy. So if that's resonating with you and if that feels like it would be helpful for you, reach out. Let's talk.